A good day to you all. This is Dr. Shivam, and we are going to listen to a very interesting tale about thyroidectomies. Its history. The first ever recorded thyroidectomy was attributed to Abdul Qasan in Baghdad in the year 500 AD. In Europe, it was first performed in Spain by another Arabic physician, Abu al-Qasim. In 1646, the first thyroidectomy using a scalpel was performed. However, this unfortunate patient of 10 years died and the surgeon was imprisonment. During subsequent 2 centuries, surgery for thyroid gland was considered hazardous due to its inability to control bleeding and lack of antisepsis and anesthesia. The mortality rate during that time, around 1850, was about 40%. Coming to the first half of the 19th century, two Swiss physicians, Johann Straub and Francois Condit, recommended the use of iodine to reduce the size and vascularity of the goiter before the surgery was undertaken. In second half of the century, we saw two crucial developments that helped the new era of thyroid surgery. It was the discovery of anesthesia and the introduction of antisepsis by Joseph Lister that became this surgery much safer. These developments coincided with the arrival of two legends, Theodor Kocher and Albert Theodor Billroth. Albert Theodor Billroth was one of the most prominent surgeons of his time and reduced his thyroidectomy mortality from 40% to 8%. This all credit goes to the anesthesia and antisepsis. However, you will see that the thyroid surgery is always associated with thyroid Theodor Kocher. Now, why this? He was the chair of surgery in Bern and he performed more than 5,000 thyroidectomies. He was extremely meticulous and paid close attention to the hemostasis. He was the first surgeon to systematically ligate the inferior thyroid artery, which reduced significantly the risk of hemorrhage. His mortality rate significantly reduced from 12.6% in 1870 to 0.2% in 1898. He introduced the collar incision, preserved the strap muscle, and pioneered the anesthesia and antisepsis for thyroid surgery. However, by removing the entire thyroid gland, many patients showed severe hypothyroid, and Kocher described this as cachexia struma priva. This prompted him to study the physiology, pathology, and surgical anatomy of thyroid gland in great detail, which led him to get a Nobel Prize in 1909. It was then and it was known as he acknowledged as father of modern thyroid surgery. So he gets the credit of all the thyroid whichever is going on now. Then came the William S. Halsted, who brought the culture and surgical philosophy to USA. So you can see the thyroid surgery was condemned for years as heroic and butchery. Then it was the mortality rate was around 90%, around 40%. Then in 1870s to 80, Billroth emerges and reduced the mortality rate to 8%, and then the Kocher emerged and got the Nobel Prize in 1909. Now comes the William S. Halsted, who studied under the Kocher and Billroth and brought the Kocher surgical philosophy to USA. Halsted also introduced the first residency program at Johns Hopkins Hospital in Baltimore, where he was made the professor of surgery. From his program, many famous surgeons for thyroid surgery were trained, including the Charles Mayo, Frank Lahey, and George Crail. So he worked there at Hopkins and further modified the techniques of thyroidectomy. So now thyroidectomy is a common procedure with rates increasing year on year. In contrast to the early results, complications have reduced to very much low down, and the highest volume surgeon reporting the lowest risk of mortality and morbidity. So despite all of these development, the principle of Kocher surgical philosophy with meticulous surgical technique and attention to detail continue to serve as cornerstone for the thyroid surgery. So this completes this tale. This is Dr. Shivam signing off. Thank you all for your patient listening.